My name is Lieutenant Commander Eileen Scott, and I am serving as the proctor for this exam. And let's see, and I have a master's degree in nursing specialty, maternal child clinical nurse specialist from George Mason University.
Hi, good afternoon. My name is Ruby Jackson, and I'm recording this head-to-toe assessment for Advanced Physical Assessment, Nursing 505. Good afternoon. My name is Ruby Jackson. I'm going to do a head-to-toe assessment with you. We're going to start with the upper extremity and then lower extremity, work our way to the head. I'm going to do some inspection, palpation, precaution. If anything discomfort that you feel, please let me know. There will be some guidance things for you to do. So is that okay with you? Yes. All right. So we're going to start with the lower upper extremities. We're going to inspect the skin for bilaterally, meaning the both arms. So we're looking for temperature, turgor, any lesions. We recognize the individual has a tattoo on this right arm. We're going to go with the second one, the same. Inspect any hairy distribution, texture, also turgor also. I'm going to check the hands for any contour, clothing. So, see the other hand. Inspecting both hands. Then we're going to move up to the lower extremities. The same. We're going to inspect for any lesions, temperature, hair distribution, turgor as well. Any lesions on the front of the foot, nothing. Seem to notice there's a little scarring on the knee area, but it looks is healed. Just some little discoloration. Anything also turgor on this area of the feet. So nothing to report on that. We are going to move on to the head, which with the head we have to make sure that we check the skull, make sure that there's anything like lice, dry scalp, or any dandruff on that area as well. I know the hair is filling. So we're going to move to the frontal sinuses. I'm going to push down it. Does it hurt? No? Then we're going to move on to look at this symmetric of the nose. And also any hair distribution, any unusual, abnormal findings on the face, any drooping. So we're going to move to the lower legs to see if any varicositis and also any edema that could be related to cardiovascular diseases. Go back to the nails, any color cat refills on the nails, on both hands. Okay. You're going to go to the head and we're going to check on the temporal mandibular joint, which I'm going to touch it. Does it hurt over here? Can you open and close? In this way, assessing if there's any clicking. This doesn't hurt. Can you smile? Clench your teeth. Stick your tongue out. Move it left to right. Frown. Can you frown your eyes? Shut your eyes all the way tight. And all right. Good job. So we're going to move to the lower legs to see if any varicositis, and also any edema that could be related to cardiovascular diseases. Back to the nails, any the color cap refills on the nails, on both hands. Okay. You're gonna go to the head, and we're gonna check on the temporomandibular joint, which I'm gonna touch it. Let's see, hurt over here. Can you open and close? In this way, assessment is any clicking. This doesn't hurt. Can you smile? Clench your teeth. Stick your tongue out. Move it left to right. Frown. Can you frown your eyes? Shut your eyes all the way tight. Alright. Good job. That's the color of their lower extremities and both legs. And also, go back to the nail. We're gonna check the color and adherence of the nail. That's it for now. Check the temporomandibulars. So, joint, can you open up again? Clench it. And move your side to side. Any hurt at all? Okay. Discuss the Snellen test and the Rosenbaum test. So the Snellen test is it's done with the visual chart from 20 feet, and that tests your farsight. The Rosenbaum test is 14 inches weight and tested for your reading. This is nearsighted. And now we can do the peripheral visual test that it will be going just with my fingers. You're gonna see. So can you see this? Can you see this? You gotta move your eyes. Can you see that? Mm-hmm. Good. And now we're gonna do the sixth cranial test. That is gonna go like an X. You're gonna follow the light and then cross. There you go. So follow down. I'm gonna redo another one more time the peripheral vision visual test. So you're gonna tell me when you can see my eyes. Maybe.
Oh, do you want me to tell you, like, okay.
Yeah, so
It's
my
like
fingers are right here.
It's like around here, or I can
Yeah,
start
where
seeing
can you see it?
I can see it.
Okay, and then it's, I think this is on chest.
I can see it.
You can see it? I'm going to do the corneal light reflex. I'm going to cover one eye, cover yourself with one eye. And can you see? Cover the other eye. The cover and uncover test. So I'm just going to cover one eye and see if the other eye's going. Right. On the other one. Okay. Are you okay? We're going to assess the eyes and looking for the lens shape, color. Any issue with arteries or veins inside the pupils? You okay? Okay. I'm gonna go back in the eye and inspect it after this for any shape, colors. You okay? Fall asleep. Alright. any vessels, atrophies. Now back to the eye. Yeah, like the macular vessels, retinal background, and foveal control. On both eyes, because it has to be. And go back to the phase to assess for, inspect the eyebrows, eyelashes, inspect the lacrimal sac. Open your eyes. I'm just going to inspect inside the external eye, which is the iris, corneal, conjunctiva. Look up. Any atrophy on the vessels. Does that hurt? No. Here. Alright, we're gonna move on to the ear. We're gonna inspect the auricle and the mastoid, external mastoid, and then we're gonna inspect it inside the ear. Looking for the tympanic membrane, and we can see the internal structures on the ear. Already infection. Good. And the same on the other eye, auricle and the external mastoid. And also to check inside for the tympanic membrane, inner canal. Alright, we're going to do the whisper test, so I am going to cover one, and I'm going to cover it up, and now I'm going to say, and you're going to repeat the word I'm saying, okay, in English.
Dog. Potato. Rice. Cat. Bicycle. Car.
Right, okay. Oh, okay.
Not yet.
Now we're going to do it on the Ryan test. It's on the serum mastoid. Hear them? I'm going to inspect the nose now. We already checked for symmetry on the nose. So we're going to inspect if there's any obstructions inside the nostrils. Okay. See, no. Now we're going to do the olfactory smell test. You can lower it down and out. So open your mouth, stick your tongue out, and say ah. Okay. I'm going to check for the size of any lesions on the tongue. Right? Stick your tongue out and then move it left to side, up and down. Okay. Stick your tongue out. I'm just going to check a little bit more in depth on the lesions any on the side of the tongue. Okay. I'm going to check the gingival area, teeth. Just to count that this individual has some braces on. Okay. And I'm going to stick this in the back to see if any gap reflexes or just how'd that go? Alright. And I'm going to ask you to drink a little bit. And don't swallow yet until the go ahead, swallow. And you do it again and inspect the tongue and inspect the frenulum. Any workings and extensions.
Thank
You check her neck and so symmetry, whether there is any abnormality. You shrug your shoulders. Any pain? Move your head to the side. I'm not telling you to sleep. Move it to the side.
Oh.
And then the other one, the other side. All right. And then go like for check the neck, the trachea, symmetry, any bulges, masses, lesions on the neck. Just gonna check the back of your neck. So the spinal process and the cervical. Okay. And now we're gonna do the random motion of your neck. So turn to side and side, back and forth. Any discomfort on that? Right. We're gonna do the no, let me know anything else. No. Sublingual and submandibular. And I can't remember that one over there. Go ahead. I'm gonna repeat the notes that I just did. So we got submental, sublingual, and submandibular nodes. And then we got to the occipital chain. And we can check the carotid already on that area as well. And we can check, I'm gonna swallow, not yes yet, but drink a little bit. Then I'm gonna check your thyroid gland, so go ahead and swallow. Alright, we're going back to, we're gonna check the pre and post auricle. And then we'll listen to the carotid artery. On both sides, so you can see the different, are they relatively equal? Alright, we're gonna go now with the lungs, and we're gonna inspect the anterior and posterior for any symmetry, any abnormality. I'm gonna observe the individual breathing, so you can breathe normally. Okay. We're going to inspect it. And in the back. I'm going to ask you to say 99, so hang on to it. All right, go for it.
99, 99, 99, 99, 99, 99.
Now we're going to listen to the lungs, posterior and anterior. I'm going to ask you to take deep breath when I tell you. Take deep breath for me. Go. Again. 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 And last. And good in the front as well. Take deep breath. Again. Now we're going to percuss on the back, and he told me if you have any pain and then discomfort. You okay? And we're just gonna breathe normal so I can see if any E. coli on the front part as well. Okay. Okay. And percussive diaphragmatic percussion, so take deep breath. There you go. Alright, so we're gonna go with the cardiovascular system, and we're gonna palpate for the point maximal impulse. See if any abnormalities on it. Any murmurs. And then we're gonna go and listen to the different part of the heart, which is our aorta is on the second intercostal space, which I'm trying to find. That's 1 and 2. And listen to that. Breathe normal. Yeah, it's a little heart rate. And then the pulmonic, as well in the second intercostal space as well. Have you ever told that? You just run a lot. Okay. The Earth's point will be on the third intercostal space. Heart rate. I'm not giving you a diagnosis. I'm just telling you. The tricuspid moving down, and the apical. I'm going to palpate the temporal pulse. Brachial. Radial pulse. I can't say that one. Popliteal pulse. I didn't say it right. The pedal dorsal pulse. Bilateral on both sides. You can also inspect the chest for heave, lift, and thrust. Right. We're going to inspect the abdomen. With the abdomen, we have to make sure that there's anything bulging. So we inspect the incision of the umbilicus to see if any hernia that can be shown on. Going to listen to it first, all 4 quadrants. For vowel sounds. Did you eat today? No. Do you have lunch? Okay, there they are. Alright, so I'm gonna palpate. Sorry. Oh, sorry. I'm gonna percuss first. You okay? No. palpate. Does it hurt? Alright, we're gonna palpate for the liver. Sorry. Then inside of this has to palpate the spleen. And then we get palpate the kidneys. Now, if I can palpate the kidneys there. I believe they wanted us to also measure the liver. Yep, on the back on it. I failed to mention, I'm going to percuss the liver and percuss the spleen and palpate both organs. We're going to do the musculoskeletal exam. We're going to inspect alignment and palpate the different joints, both bilaterally. Next. And then we're gonna do in a little bit the lumbar range of motion, but for now we're gonna do the legs range of motion. So I will want him to knee all the way to your chest if you can, but if you cannot, then let me know if I'm hurting you too much. Okay. Roll it down. Try to raise your knee up. Okay. Now we're going to do the same thing for the other one. Knee to your chest. Are you okay? Alright. And do the same thing. Okay. Try to lift your leg up. The other one. Okay. Now we're going to do external and internal. You okay? Right. Bring again your knee up. We're gonna do, see if you can press your leg to the side. And do the other one as well. Okay. Now put my hands in between and you try to squeeze my hands in. Good. Now, right, we're gonna do the rest of the musculoskeletal. So do this. Rotate your shoulders up. Alright. Lift it on. And both arms. If you can. Alright, I want you to fingers all the way. Hand, the other one again. Squeeze my hands and then fingers. Good. Already done that. We're gonna get this strength, so push in. Oh, you're strong. Okay. Good. Alright, so I'm going to check reflexes. Good. Alright. Here we go. Need reflex. Good job. Good job. Maybe you can see the ankle jerk. Move. I'm going to do the ankle range of motion. So you're going to touch your feet to the ceiling, both feet, and then to the floor, and then moving them around. Make a circle motion. Okay. Right. So push against my hand. So, there you go. The other way. Now we're going to assess the thoracic and spinal. So I'm going to need you to twist your to the sides. Alright. Bend and touch your knees. I don't look for any abnormality in it. Are you okay with that? Stand up. To the side. No. This way. You're doing that, okay. I need you to walk with you, backwards and forward. Okay, and now heel to toe walking. inches, you're okay. I'm gonna do the Rumson's test. So you're gonna close your eyes, feet apart. Do you feel like you fall over? No. Okay. Good job. One is stenosis and graphesthesia. So see if you feel anything sharps in there.
Sharp. Sharp. Sharp.
Okay. Now I'm gonna ask you to touch your nose. Again, down. The other one. Again, repeat it again, and the other one. Again, form the rapid and determinate movement. So I need you to sit down, put your arms up on your lap, and then rapidly go up and down. Do your fingers again, and then tap on the floor. I'm gonna assess the vibration sense. Feel that? Alright, we're going to do the position test. Close your eyes. And I'm going to say, how's your finger?
Up.
Again.
Down.
Once again.
Up.
And again.
Down.
This concludes the head to toe assessment.